Vitality.
Vitality Unfiltered.
Unfiltered.
With David Bauder.
Welcome back to another episode of Vitality Unfiltered. I'm David Bauder, your host, and today's topic will be discussing hormones and skin health. Joining me today from Weight Loss and Vitality is Dr. Christopher Reeves, Medical Director, and Stephanie Lattimore, Nurse Practitioner, Stephanie Lattimore from the Washington, D.C. location. To start off this conversation, this is one of my favorite subjects, and it's partially one of my favorite subjects because we see it every single day, patients in the clinic coming in. They're on numerous skin products, cosmeceuticals. They're using tons of hydration components on their face, have tried a whole bunch of things. They're frustrated, they're aging, they have breakouts, eczema, something's going on with their skin. The cosmeceutical industry represents in the United States roughly a $22 billion market. There's a lot of people buying a lot of different products. But most of these patients that come in to see us, they never have recognized the fact that most of the skin health that is associated, what you see on the outside is a reflection of what's going on in the inside. So skin from the inside out is fed from the body, whether that's hormonally related or nutrient related. And so if we're only treating skin, the whole conversation today is going to be about this. If we're only treating skin from the outside, you're missing a whole component of what you can actually contribute to the overall health of the skin and decreasing the aging factors. So to start off with, I would like to get the question or answer the question is does skin listen to hormones?
Skin listens to hormones loud and clear, for better or for worse. So the skin is the largest organ in the body. I love that fact. Think of the skin as an organ for framing of this episode. And the skin is an incredibly hormone-responsive organ. It listens to and responds to all the major hormones. I think of estrogen, progesterone, testosterone, but also cortisol, thyroid, and other stress hormones as well. So to think about it this way, times in our lives, men or women, when we have fluctuations in hormones, kind of helps me think about the way that hormones affect the skin, puberty, menopause, pregnancy, maybe trying to conceive. Your hormones go through these fluctuations that are many times reflected outwardly on the skin, right? We think acne, dryness, changes. PCOS is a good example of a hormone condition that is commonly reflected in the presentation of the skin. I do want to share with both our viewers and listeners a few of my struggles that I've had with how hormones have negatively affected my skin. If you're listening, I have struggled with some hormonal acne as I come toward the end of my breastfeeding journey, getting my regular cycle back, big breakouts, big cystic acne on my chin and lower face. For our viewers, I'll share some examples of what I've been struggling with as recently as last week. So for me, hormones are definitely more than skin deep. They come from within and are reflective of an underlying process in the body.
And then I guess for the conversation today, we'll just go from the top to the bottom and we'll address like some of the main hormones that have the most impact on the skin. The body is filled with hormones. There's common ones and not so common ones. But we're going to address more of the common hormones to start off with. Probably the hormone that has the most impact on the skin, I would say, is estrogen.
Yeah.
I mean,
yeah. Estrogen has a lot of roles in the skin. Yeah. Like it binds to there's different components that kind of make up the skin. There's things called fibroblasts, there's keratinocytes, and estrogen binds to these structures and it upregulates some genes. And basically, what it does, in layman's terms, is it increases the thickness, the fullness, the bounciness, and the durability of the skin is what estrogen ultimately affects. And in menopause, within about 1 to 5 years of menopause, onsets of menopause, when estrogen levels drop, you can lose about 30% of your collagen can drop in about 1 to 5 years, from that. And so that's where you have some of the changes you see in, thin skin, tearing of the skin, loss of volume, fullness, hydration. All these factors are impacted greatly by the declining levels of estrogen.
And then this is so many patients deal with this. And it's, again, in aesthetics, you have Botox, dermal fillers, aesthetic surgeries, cosmeceuticals. So these patients, estrogen levels declining, the volume of their face is going away.
Fill it with fillers.
Mm-hmm. And then you keep filling with fillers. Then you overfill with fillers. fillers have a role. We're not saying that fillers don't have a role. We like putting dermal fillers in patients' faces, but it still goes back to these basics and these foundation aspects. Is you want to do the preventive aspects of the aging face. You want to slow the aging. You want to keep as much natural collagen in the face as possible, and you do that with estrogen. It's that simple. Okay. What role does testosterone and progesterone play?
Two other important hormones, sex hormones, that play a huge role in skin health. And the key theme here is balance. So we need testosterone and progesterone to be balanced because we'll have side effects on either ends of the spectrum, too high or too low. Progesterone has a calming effect on the skin as it does the body. So very helpful for reducing inflammation and bringing water retention and water to the face. So that's going to help. You're going to lose that in menopause. So that can lead to the development of fine lines and wrinkles, that loss of volume. On the higher end of the spectrum, you're looking at that hormonal acne. You've seen this in women trying to conceive, or on progesterone for IVF. They're going to struggle with that water retention on the other end, that bloating in the skin, as well as the acne. As far as testosterone, both important in both men and women. You're going to get that oil production, which is essential as a protective barrier for the skin, but in excess can cause that acne. So it's all about that balance. But testosterone and progesterone are crucial hormones that affect the skin.
And I think there's also a subtle fibroblast stimulation with testosterone. It's directed towards the fibroblast too, the testosterone, because again, I'm pretty sure it goes back to that positive nitrogen balance. It pushes nutrients into cells, and it's an anabolic hormone, and the counter to that would be cortisol. Cortisol is the opposite of that, where low amounts of cortisol for just short amounts of stress really has no downside to the skin. But chronic cortisol, thinning of the skin, that is where patients age. And you can see this in people. You can see patients that are under chronic stress. Chronic stress equals chronic cortisol, thinning of the skin, advanced wrinkling, the dryness sensation in the face. It's a dead giveaway. You can see it in pictures. You just have to look at anybody that's taken the office as the president.
That was my example. I was like, look at them at day one and then year 4. Night and day.
Night and day. They are under chronic stress the whole time. Yeah. Another big hormone is the thyroid.
Yes.
And what's that one do?
Thyroid, low thyroid hormone can cause also skin problems because it can decrease the production of hyaluronic acid and, can cause dryness. And you can get, again, the same thing, dryness, fullness, and thinning are kind of like the three kind of hallmarks of what these abnormal hormone levels or managing of these hormones have their manifestation on the skin. And so correcting for all these things can help to mitigate some of those imbalances.
Why do you think that, I wonder, why is this such a topical world that we live in? It's easy, it's available, it's marketing.
I think that our culture and society takes kind of a top-down approach. To skincare and thinks of, topical. It's kind of a easier strategy, maybe a little bit more instant gratification. It seems a little more accessible when really skin health has to be viewed at from the inside out. So we have to take care of the inside in order to get what we want on the outside. That means hydrating orally, drinking water, taking water in, nutrition, really taking care of the body in order to present how we want on the outside. The same can be said for limiting sun exposure, right? Stopping smoking, really an inside-out approach. Topical skincare is great and there's a role for it, but if we're not taking care of the underlying skin as an organ, we're not really going to have the results we want. And I've seen that with my hormonal journey as well. Nothing topical I could use was even affecting my skin because my underlying hormones were so out of whack and so out of balance. Nothing topical would even touch my acne. And this being said, our skin is going to evolve and we need to adapt our skincare routines with our skin. If testosterone is decreasing, that oil production is decreasing, we might need to up the moisture regimen that we have. So skin health is kind of there's progress. We have to adapt as our skin changes with our treatment.
Well, there's also the component of gut health has an impact on skin. During the pandemic, I was working with some Japanese scientists, and they're very proactive with the probiotics, prebiotics, gut health, these kind of things, very much so in the cosmetics as well. Japan, I think, is a lot more advanced than most other places in this. And so there's a group of researchers there I was working with that had some probiotics that I was looking to try to bring them here. But during the pandemic, it was impossible to do any import, export because everything. But the research that they had studies they had done, not only did these probiotics good for immune health and that sort of thing, but it also was skin health. And so they had a lot of studies that were showing rebalancing some of this the gut microbiota and that sort of thing had positive impacts on acne, skin integrity, thickness, and all those sort of things. And I think we might do a dysbiosis podcast at some point. Maybe we can dive in it a little bit deeper at that time.
And it only makes sense, right?
Yeah.
I mean, the gut is involved with so many different things, from a nutritional aspect to a clearing aspect.
Yeah.
It actually breaks down hormones.
Yes.
So the gut is involved in every single thing associated with that. Hydration, the gut's involved with hydration. So when you think about skin health, it's all right there.
Absolutely.
When you work up a patient, I don't know if it really is different that much for a skin, somebody coming in for weight loss versus somebody that's looking for skin health. Because if we're talking this conversation in reference to hormones, what would be a reasonable workup for a patient that wants to have their hormones looked at to see if it's involved with their skin health?
Good question. If I were to work up a patient who is coming in for hormone evaluation in the context of their skin, I would absolutely consider what medications they are currently taking, what their lifestyle looks like, behavioral habits. Are they a smoker? Are they a drinker? What their nutrition looks like. Are they getting enough water? Are they getting enough sleep? So definitely that holistic, whole picture, comprehensive health, because that will help to address if the underlying skin problems are hormonally related.
I think all in all, I mean, this is a multifaceted type concept where we're talking about hormones, and certainly hormones are not the only thing. And by no means are we trying to say that using retinols and things like that or topical medications don't have value in the health of the skin, but it's a combination type approach. Do you guys have any closing comments?
I guess, I have a question. So do, I typically see women will come home and they'll have their 17 different products in their routine. They do this sealer and this and that, whatever. Guys, we just throw soap on our face and then go to bed. Should men employ a routine, a face care routine?
Really good question. This is a great example because it's me and my husband, and his skin is perfect, and I have struggled with mine. But I think it's very individualized. You can look at the big picture and look at the what patients are trying to get out of their health and what they're trying to get out of their skincare and what their goals are and how they feel about their skin, because it's very individualized. And I would never want to project what I see in someone else. Everyone's going to look at themselves differently, and under a microscope, especially women when it comes to skincare. So I think there's a role for good skincare, good skin health, depending on the patient. But everyone should employ the inside-out approach when it comes to health and wellness on the deeper level.
And I would answer that just we use a lot of ZEO health. We use a lot of ZEO skin products in our clinic, and it's very different, especially in this conversation that we're having today, is because a lot of what we're referring to are the diminished hormone levels of women with perimenopause and menopause, and the dramatic effect that will have on the collagen, the fullness of the face. But men don't necessarily experience that the same way, right? Their fall off of hormones are much more insidious, and so it's not as sharp. And the skin in men also isn't strongly super correlated to estrogen levels like it is in women. Men generally carry a much higher testosterone level. But with saying all of that, and so there's definitely an effect with testosterone and skin health. But with saying all of that, the principles still stay the same. If you're in a standardized skin treatment protocol, there's certain things that we kind of know just work. There should be a vitamin C. There should be a cleanser. There should be an exfoliator. There should be a vitamin C. There should be sunscreen. And then the verdict's out. Should there be a hydrator, or should there be something that stimulates the cells into making things? So real cosmeceuticals, this is going to step on some people's toes. But the idea that people just lather up with a moisturizer is it's kind of, in my opinion, it's a flawed concept. Because when you moisturize, when you lather up with a moisturizer, my belief is you basically turn off the moisturizing component of your cells. You make them lazy. So you have to use more moisturizer. Versus like a retinol or some stimulator causes those cells to actually generate more product. It stimulates the cells into working. Well, that's what you want. You want baseline, deep, healthy working cells to keep the skin youthful and young. So I'm not a big proponent of moisturizers. And so like, for example, ZO, for years, they had something called the Daily Defense, the Power Daily Defense. And that one skin care product was supposed to be an anti-inflammatory, antioxidant, stimulator all in one, with some growth hormone effects also. So that was a great regimen for men. So if men were gonna go out there and do a really good skincare product, it would be just what I just said. It would be a cleanser, an exfoliator, maybe a toning pad that would balance out the pH level on the skin, so it would be a little bit more amenable to absorbing whatever you put on the face. When you wash your face, when you wash your face, it's more acidic. No, it's more alkaline. And so you want to apply a little bit of salicylic acid on your face so it absorbs the product that you're putting on. And then you want to put your Daily Power Defense on. That's an excellent protocol for men if they were going to do that. And it's just sometimes becomes overwhelming because like you said, you've got all these things sitting in front of you and it's like, what day of the week is it? Which one of them? I mean, it does.
It does. And I think that, you watch commercials on TV, this will fix your acne, red spots, dark marks. We have all this product marketing. But if we don't have a healthy baseline, a healthy canvas that is well hydrated from within, you can throw topicals at your skin all day and you're not going to see the results you want. So
yeah, I absolutely agree. And then it also goes upstream from that. And we hit on this, but it's such a big picture. Are you eating right? Is the nutritional component there? Is your gut healthy? Right? Because the nutrition's not coming across if the gut's not healthy. Are you hydrating? Are you sleeping? Are you getting rest? Are you resetting your cortisol levels?
Exactly.
I mean, it's all of it. It's all of it together. And then to try to do everything right would be, and are you using these good quality skincare products? And we could actually have a whole episode just on skincare products because not all skincare products are equal by any stretch of the imagination. And so, I mean, that's a lot of information there, right there.
It is.
Yeah, but it's important. Skin is the biggest organ in the body.
Yeah. That's right. Yeah, so I think that really summarizes everything for us. And just I want to keep for the listeners, just keep in mind that the skincare is not just from the outside in. It's from the inside out. You should start the process of thinking about how well your body is hydrated, how well you're eating, you're sleeping, your rest, your exercise, all of these things that manage on a much bigger level and scale in your body. And when you do that, you start to control the aging aspects of your skin. Then you jump into, are your hormones regulated correctly? Are your hormones regulated correctly? Okay, they are or they're not. If they're not, that's something that can be explored and treated. And then of course, you want to apply sunscreen and you want to use the healthy products and the topicals. That all of these things are beneficial to overall skincare. So if you enjoyed the show, make sure you click the link below to subscribe, and we'll see you on the next episode.
Thanks for joining us on Vitality Unfiltered with David Bauder. Addressing norms, busting myths, and uncovering health realities for a more vibrant life today. For more expert insights and real talk, make sure to subscribe and join us next time.